We have Dr. Mekel Harris, one of my favorite people to talk to, and talking about sleep, the nervous system, and really how do we find ease during hard times when the heart is heavy, whether that's grief of a loved one or change in life, right? We are all going to experience grief, loss in some form or another. And Dr. Mekel is going to give us wonderful insights as always. So I'm really happy to have you, Mekel, here. Share a little bit more about yourself and let's get into this fabulous conversation.
Perfect. Well, first of all, thank you for carving out some time. I always love seeing your beautiful face and just sensing your presence. It's so good and it's so calming. So I'm just happy to be here. My name is Dr. Mekel Harris, and I serve as a licensed psychologist who specializes in grief and loss. And that is a path I never in a billion
Mm.
years thought I would be on. However, December 2012 was a pivotal moment in time. That's when my mom died of stage 4 pancreatic cancer. And after her death, I realized that I wanted to sort of be what I needed at that time. And so I have shifted my career over the past 15 years um, to focus exclusively on that. And it's been a really beautiful, beautiful process. So, yeah, thank you again for having me.
You're welcome. And isn't that fascinating? Hey, how life gives us these things that we never thought, but then it's the gift, and here it is. And here it is where you consistently do such like even just like thinking about it just gave me that beautiful sigh of relief in the way that you share and really frame grief and life with such compassion. So
Mhm.
now, I think when one is suffering loss, when one is suffering grief, sleep is absolutely one of those side effects that get affected for sure. Maybe one sleeps too much, right?
Right.
Because that's one result, or one doesn't sleep enough. And
Yeah.
what are some of the ways that you work with your clients to support that intensity of
Well,
feeling?
before I answer that, I want to share some data that was really startling. Every time I see this, I'm always startled, which is that 1 in 2 people develop sleep problems or insomnia after experiencing a loss. So let's just put that out there. This is super common, and loss, we're not just talking about the death of a person, but as you alluded to, life transitions, loss of expectations, a lot of things that we experienced around the pandemic and so forth. So, super, super startling statistic. So, how do I interact with people who are experiencing sleep problems? Well, the first thing that I do with my clients is normalize that. I think often people come in and they're shocked and they're wondering, why can't I sleep? Right? I was a great sleeper before. Why all of a sudden am I not sleeping? So, a large part of this is educating, which I would love to do for your audience if you think that would be helpful. So, no one wakes up on any given day and thinks, oh, this is the day I'm going to experience a sudden loss. This is the day my life is going to shift in a stark direction that I never anticipated. And what that does is it literally rattles the nervous system. So, our nervous system is designed to stay in what we call homeostasis or balance, and it loves it there. That's its sweet spot. However, when there's a sudden or even an anticipated loss of some sort, the nervous system kicks into sort of that fight mode, and it does that in order to keep you alive and keep you functioning so that you can address the stress. The problem is with grief is that it is not ending. Grief is a lifelong process. And so the nervous system has a harder time sort of getting back to the place where it can be calm. And that can cause a whole chain reaction. One, in releasing a stress hormone called cortisol. Cortisol is inextricably linked to sleep. And so when cortisol is too high, it just regulates sleep patterns. And then there you go, back to the statistic 1 in 2 people having sleep problems or insomnia.
That's huge. And then that explanation is super helpful too, I think, for people to hear. And yeah, like I love the first thing you do is normalize. Because isn't that the thing? And isn't that the thing how so many of us are like, I'm the only one who doesn't sleep. Something's wrong with me.
Yeah.
It's all my
Yep.
fault. And it's like, no, sadly, this is normal. This is because, and then having that wonderful explanation of, well, it's your nervous system. Your nervous
Mm-hmm.
system's trying to help you. And
Mm-hmm.
it's spiked because it's actually trying to help you because you're going into this
That's
really
right.
stressful time. But yeah, then
Which
it's
I
having,
wanted I want
yeah.
to comment on that. I think that sometimes people get upset. So I'll be honest, when my mom died, sleep was completely out of whack, in large part related to me sort of being in the bed with her when she passed
Mm,
away. So that was a really huge trauma for me. Um, and I didn't make the connection between sleep and grief for a while. And so I think a lot of times when you offer that education, people can see uh, the link between body, mind, and spirit. They really are one thing. And sometimes we look at our bodies and our sleep as sort of separate entities, and then there's grief, but they're all
mm.
combined and they all influence each other in bidirectional ways. So that's a huge place to start.
Mhm. It is, and that's really like it's funny how we compartmentalize things and how we think, yes, oh no, my sleep like but that is and that's that practice of yoga, of just that reminder that we are more than just a body and just a mind, that it's all of it and it's
Hmm.
interconnected and how we're how do we then support those things? And so
Hmm.
when somebody goes through loss and change and their nervous system doesn't settle back down in a reasonable way. And what's reasonable? Like where the cortisol levels are still remaining high. And then sometimes I know with cortisol, it can go high and then it plummets and then you're in like low cortisol and your cortisol is not even
Yeah.
doing its thing anymore. We're not like you're
Hmm.
past the high point. And
Hmm.
so how, and I know that's a multi-pronged answer. And within the scope of this conversation, then what is something that we can do to help support the nervous system and cortisol when, as you say, life is this, or grief is this lifelong practice. Practice,
Yeah.
huh? That's funny experience,
It,
but practice as well, I
It
suppose.
is, yeah. And there are a lot of practices that we learn as a result of grief. So I think one of the things that I like to start off with is talking about gentle movement. So, somatic practices. Yes, as a psychologist, I talk with people, of course. At the same time, the integration of sort of talk therapy in a traditional sense with somatic practice becomes really huge. And so I can offer clients a recommendation to focus on gentle movement. So I am a person who loves cardio. And when my mom died, I remember going to my physician and I was like, gosh, things are out of whack.
Mm.
And I'm working hard. I'm doing cardio. I'm trying to make myself exhausted, like just to wear me out because my sleep was so bad. And the doctor was like, mm-mm. He said, actually, what I want you to focus on is moving as slow as possible. And I thought, what? I'm not going to survive. I'm a cardio queen. But what he was getting at was this notion of cardio and really high intensity exercises keeps our cortisol level up, and we don't want that. And so, slow rhythmical movements, for example, walking, intentionally walking slower, getting outside in nature to do sort of grounding activities, literally planting your feet on the ground without sort of a racing idea of let me hurry up and get through this, but really feeling the ground, really soaking in all of the senses around you. There's a wonderful grounding exercise. It's the 5, 4, 3, 2, 1 experience. And that really serves as a wonderful place for people to, number one, focus on the present, but also inherently slow down, emphasizing breath, emphasizing sensory input that sometimes we forget when we're grieving.
Mm. Well, I'm pretty sure I can hear some people in my who are listening to this right now. They're like, "What? 5, 4, 3, 2? Please, please, Dr. Mekel, please walk us through this." So, would you
Yeah.
mind, like, would that be helpful just to do a brief overview for people? Thank
Absolutely.
you.
And so this is one grounding exercise of many, but essentially the whole focus of the 5, 4, 3, 2, 1 exercise is to really emphasize our senses. So And I want to say it doesn't necessarily matter what sense is connected to the number. This is simply the way that I do it. So after a person is sort of planted and they're placing their feet on the ground, whatever that is, indoor or out in nature, they're going to open their eyes and sort of focus on five things that they can see in their environment. So, for example, I can see my computer screen. I see you. I see a sticky note. I see my latte. I see my keyboard. So, five things you can see, four things you can hear,
Hmm.
right? So, cluing in to, again, environmental sounds. Three things that you can touch. So maybe it's the feet on the ground, your body seated in a chair, or even the clothing on your body. Okay. So three things that you can touch, two things that you can experience in your body. So this is sort of getting into the kinesthetic sort of realm. And that may be moving of a finger or adjusting the shoulders or just recognizing something internally that's going on. And then lastly, one thing you can smell. So by the time you do this, and again, this is in a gradual, gentle way, you are number one, focused on the here and now. And that inherently slows the nervous system down, lowers your blood pressure, lowers your heart rate, which is super helpful. And it can be done anywhere, which is one of the reasons I really love grounding practices.
I love that. And that actually specific that was new to me. Thank you. That like that very specific and right away then I go, okay, kids, this is a great one to teach children from a young
Mm-hmm.
age.
Mm-hmm.
Probably a really great thing to do before bed if one's mind can't stop
Yes.
racing, right?
I actually do this every single night because even 12 years later, I still have moments when I get in bed that my mind takes me back to that moment when my mom died. And so
Mhm.
I feel internally dysregulated. And so focusing on the grounding really helps. And before I know it, I'm yawning, my eyes are feeling a little bit heavier, and so forth. So, yeah, grounding practices are really powerful.
Mm. And I'm curious too now, when you say that you've been practicing this and very similar grounding practices for 12 years and that length of time. Well, first, I love that it's like didn't cure it, right? We live in a world where we're just like, what's my fix? How
That's
do
right.
I stop this uncomfortable feeling? How do I
Mm-hmm.
and these things will not, as you said again, grief
Yeah,
will be with you your whole life.
right.
But I'm curious to know what this 12 years of patterning for yourself
Mm-hmm.
for your mind body for that somatic experience, what happens when you do it? Do you find that there's like a quicker familiarity, or is it just like, oh, hello old friend, hi my, like what's that all these years later, what's your relationship to that practice?
Yeah, that's a great question. And it kind of links to something else that's really good for those who grieve, and that is routine and predictability.
Hmm.
So, again, grief is startling, whether you anticipated it or not. And that can make you feel very dysregulated. So, just knowing what's coming up and having some controllable variables, if you will, throughout your experience can be really powerful. So for me, it has become where a thing where when I start thinking about the fact that I'm going to do this grounding exercise, I'm already yawning now, right? I don't have to necessarily get too far into the practice to then yawn, but it's also something I can predict, which makes me feel really grounded and comforted and safe, which is also important as you grieve. So, setting up routines is super important. Another thing I wanted to share was scheduling time for grief, which sounds really strange because you're like, of course I'm grieving all day long. What are you talking about? Well, this is really intentionally leaning in to the grief. And no, that's not comfortable. No, that's not sexy. But the alternative is if we don't actually lean into it and strive to avoid it, what we're doing internally is raising our sympathetic nervous system signals, which is keeping us in a heightened sense of stress, as opposed to predicting, okay, here's the time that I'm going to lean into this a little bit and have an opportunity to cry, to speak, whatever it is that's sort of externalizing the grief, which again kicks the parasympathetic nervous system in, which helps to calm us down.
I love that so much. We all, okay, this is my movement time. This is my mindfulness time. Like, ideally, we're trying to schedule that in so that we actually do it.
Hmm.
And it's no different to do it for the discomfort and the uncomfortable things. I love that so
Yeah.
much because it gives
Yeah.
value. Look at, so like, we're valuing our good things, like must do
Hmm.
the movement because it's good for me. And
Hmm.
then by not scheduling in the grief, in a way, we're unconsciously devaluing it
Hmm.
because it's not going on that schedule. So that is, in my mind, maybe to other people, maybe not, but to me, that's revolutionary. And then it's like, and then you're giving yourself full permission to feel all the feels. This is,
That's right.
I'm going to scream for 5 minutes. I'm going to cry. And that's just as valid
Hmm.
as the breathing, the
That's
movement,
right.
all the good things,
Yeah.
it's all because it's all good. Your
Hmm.
pain is good. The
It
discomfort is
is.
good.
It is. And again, the alternative is I sort of think of this like a balloon. If you walk around and we inherently have a balloon, and then you add day to day stress, grief, physical health challenges, sleep issues, like you're just expanding that balloon to the point where the only option it has at a certain point is to explode. And that's when we do start to see sort of manifestations, whether it be mental health challenges, physical health symptoms, and so forth. And so, what greater gift can you give yourself than having a chance to sort of let out the air in that balloon so that you can continue navigating a really difficult journey?
And not, and what I'm hearing too, it's that again, it's not in good ways. Because I was thinking, okay, well, I would schedule a therapy appointment to talk about the grief and the pain, which is totally good. And please keep doing
Hmm.
that, everybody. But that's also still kind of in my mind, I'm hearing that as controlled and helpful, but there's something kind of beautifully messy in
Hmm.
scheduling. I'm not going to talk about it and learn and be good. I'm going to just be messy and be totally raw and like,
Yes.
and get it
Yes.
out.
Yeah.
And that's, I like, so that's another layer. I watch my own mind, yeah, going, okay,
Yeah.
everything here's got to do the good things.
This is coming from someone who, when my mom died, I was literally just very intent that I was not going to grieve. I didn't want to be part of that club, even though I was a psychologist at the time. I was like, no, that's not going to be who I am and a part of my experience. But um, after working with a really great therapist at the time, I realized I've got to lean into the grief, and if I don't, the consequences are actually way greater than if I lean into it. So that's what really started the ball rolling for me. And what I do now is a couple times a week, I have scheduled 30 minutes where it's my grief time. In that time, as you sort of said, I may be screaming, crying, nothing, journaling, meditating, whatever it is, but it's an opportunity to really intentionally allow myself to specifically focus on grief. And again, the connection to the nervous system is that when I leave that little cocoon, I inherently feel a little bit better, and it's helping me release some of that internalized tension.
So, so important. And especially in of course, for me, I'm coming from a yoga background, but
Mhm.
it's like these kind of yoga and wellness worlds are so, they have a little bit of toxic positivity a bit. And I'm just loving hearing this, like, again, the reminder of it is not good. Schedule your grief. And I also appreciate you giving us a little example 12 years later of what that still looks like.
Mhm.
And sometimes it's, you're not feeling like you need to cry or you're not feeling like you
Right.
need to get messy, so to speak, but you're still making time for that and
Mhm.
making time for just you in all
Mhm.
the humanness that you are. And
That's right.
knowing that it doesn't have to be this positive, doing the thing that's going to fix the thing. I'm going to be great. All is good.
Yes. Yeah. Yeah. I was prayerful that that was going to be it. That I was going to pick that one thing and just wipe this grief out completely. But I realized over time that grief and grieving is really shining a light on what I like to call your coping menu. So I'll give a little bit of an example here. And That is, if you had a favorite restaurant and you opened up the menu and it had your favorite thing, for me, it'd be guacamole, you'd be happy to go to that restaurant every day for a while. However, at a certain point, you're going to say, oh God, my palate is just, I'm just done with that. I can't even taste it anymore. I've had it so often. So, part of the work of grieving is identifying what else you can put in that menu, because over time, what works now may not work in several months or a year. And so you want to have a great arsenal or coping menu items so that you can really pull from them and do a little bit of trial and error. And so that's what I've done. And that's why it's beautiful to really try different things, even if you don't inherently think that's the thing that's going to help you.
Yeah, well, we are all so complex, and every day we're complex, and everything what worked for me last week won't work for me this week. So it's really nice to always, yeah, give yourself that menu of like, okay,
Mm-hmm.
what do I need to do? Do I need the scream
Mm-hmm.
appetizer? Do I
Yes.
need the dancing entree? Like, what is
That's
going to
right.
help?
Yes. Conceptualize it. And is your comment about appetizers reminded me that, of course, if you sit down for dinner and you eat an entree, you've got to have some time to eat that meal, right? But we don't always have time to sit down and do an entree experience. So the appetizers, when I speak to clients, are those things that you can take anywhere. They don't require that you're sitting in a certain place or that you have extended amounts of time. So one of the most beneficial appetizers is breathing, right? Wherever we go, there our breath goes. And so back to the nervous system, right? Breathing is one of the most underestimated things that we do. And so focusing on intentionality with that, whether it's box breathing or a meditation or simply being aware of the ebbs and flows of the breath, just to focus inward naturally resolves things within our bodies, which ultimately impacts the way we feel and the way that we think as a grieving person.
So it feels like you're always carrying around a little toolbox with you, and it's
Mm-hmm.
just in your back pocket. And then you're out at the grocery store and you go, there's that feeling of grief. Oh,
Yeah,
no, no, I'm in public.
that's right. What
Take that breath.
appetizer
Yeah, take the
can I
appetizer.
what appetizer can I use? Absolutely. Yeah.
Yeah.
Yeah. And then there may be times like an entree may be journaling, right? That's not something you could do at Costco. Well, yes, you could. But that's maybe going to take some more space, pen and paper, some private, space for you. And so that may be an entree. So really categorizing them to know that some of these need to be mobile, because grief, as we all know, doesn't just show up in one place. It can show up in the most unexpected places and at the most inopportune times. Yes. So,
Yeah. And I love this because so many of the conversations that we've been having on the podcast about sleep with different people all seem to come back to this concept of like, and this is the same with grief, I'm thinking, is you can't face it. It's like sleep, you can't face head on. You can't go to sleep thinking that's the journey right now,
mhm.
straight path, sleep or else, because you're not going to do it.
That's
And I
right.
think grief, in a way, you can't, well, like you can face it head on, but just know that it's just this, it's just there. It's going to be
Hmm.
there. It's going to be present. So finding different ways in
Yeah.
to, with centering it maybe a little bit more. So when we center that pain, that feeling, the discomfort, all of it, the thing we want to run from,
Hmm.
it will be there regardless, as you said with the balloon analogy. So how do we find those ways in? What are different ways in? So that's another way my brain is kind of wrapping around this idea of a toolbox. But the words were in my mind of like, prioritize your grief, center your
Hmm.
grief, center, because
Hmm.
it's not going away. It doesn't.
It's not. Actually, a great visual that I love to share and actually have on my own computer screen here that's sticky noted is three balls of the same size. Okay. So, one of the things that we want to happen when we grieve is that the ball is going to get smaller and smaller and smaller. And by the time 20 years or 5 years have passed or 6 months, we can't even see it. But that's not true. The size of that ball never changes over time. What happens is in the very beginning, there's the ball, and sometimes all we see is the ball because there's so much overlap between us and the ball, right? Grief is completely enveloping, it's all consuming. Over time, not that time's the cure, but time with effort, right, and focus and support, we then begin to sort of move around the ball so that the size of the ball hasn't changed. However, we have more perspective because we're able to see there's other life outside of this ball. 50 years later, the ball is the same size. And hopefully, that ring around the ball has grown even more as we've learned tools, practiced them, gained social support, education to help support ourselves. So it's just an important reminder that grief will always be there, yet it doesn't have to be all consuming.
That is so important for us to remember and to hear, I think, and just as, even just what you said, you have it on your as a sticky note. This is what you work with people all the time. You know this, you say it, and it's still necessary as a reminder that, yeah,
Mm-hmm.
I think as a mind really does want to, and our culture wants to lessen discomfort. And that, so thank you for that reminder that grief doesn't change, the size of it doesn't change, but our relationship to it, how we work
That's
with
right.
it, how we see it, that can we all etch that into all of our hearts so that we never
I
forget? Thank
know.
you.
Well, and it's so difficult. I'll sort of go into this maybe sensitive area, and that is the diagnostic understanding of grief. Um, mental health and the diagnostic framing of mental health concerns are really based in a biomedical model, which doesn't work. Now, we've been trying to fit this square into a circle since the beginning of time. However, it doesn't work. Now, what I appreciate about some of the understandings of grief is that we do need to be mindful, particularly if we're starting to experience functional impairment, which is basically difficulty getting up out of bed, difficulty taking care of your normal routine, difficulty leaving the house. To that extent, that framework is really helpful. However, if we're thinking grief is to go to this provider, put a band aid on it, it heals, there's a scar, and then we never see the scar again, that just doesn't work. But that is the way I think that people sort of frame it. And because we live in a biomedically anchored society, it's a constant tension at all times.
Yeah, thank you for naming that. That I think, yeah, that really informs where we sort of
Hmm.
want to like that's how we relate to grief, and that's what we think, and it's reinforced in some scenarios.
Hmm. What's really
Yeah.
nice are folks like you, right? And others who are in focusing on holistic practices, that it's not just a pill, it's not just one thing, it's not just talking to someone. Health is very complex, and there are many, many approaches and things that we can do to help address the concerns that we have from a holistic perspective. So, thank you. I know I definitely benefit from literally everything you post. I'm always like, how
Well,
does she know that my
I'm
shoulders
in
were
your head.
crunchy?
Well, slash, I think that too, like that our suffering, whether it's physical aches or pains, emotional aches or pains, is all kind of, I'm making a mass generalization here, but it's all the same. The flavor of it will be different for each of us. How we relate to it is going to be different, but we all
Hmm.
will experience aches and pains in the body. We're going to experience aches and pains in the heart.
Yeah.
And so yeah, as much as in some ways I'm like, I'm in your head. It's like I'm because I know I have
Yeah.
shoulders and they hurt, or I have a
Hmm.
heart. So you talk about grief in such a beautiful, helpful, succinct way that it's like, you take this big, painful concept and experience and reality of life, and you break it down into these like tangible ways of working with it and seeing with it. And so it's this, we're doing similar work. It's just in
We are.
different, you've
Yeah.
got the heart, I've got the bones, and there we go.
Yet, once we help one, it's bi-directional. We're helping the other. So it's a
Truly.
really beautiful dance. And I love all of the folks in the space who are doing different yet necessary things to help people who grieve.
Absolutely. And that's, yeah. So I think that brings us to a really nice sort of I hate to say the word conclusion because this conversation about grief and ourself and wellness and healing never truly ends. And I hope that this conversation that we've had today helps normalize, perspectivize, which I know is not a word, but I think it sounds kind of fun with normalize, gives us perspective around be leaning into the discomfort,
Mhm.
leaning into the thing that's already there. Like you've given us all such great insight and tools. And so, if there's anything else that you would want to share with people in terms of like, because again, ostensibly this is about sleep, but obviously we can see how having these grief practices and having this relationship with our grief will potentially help sleep as a byproduct.
Well, I will invite folks who are on social media to connect with me. My handle is at Dr. Mekel, Drmekel. And I have a lot of free resources focused on these practices that I've mentioned on here on the podcast. And so definitely check those out. And again, even if you have 1 minute, which may not sound like a lot, if you are that person, as I was, who is actively experiencing the symptoms, right? They're manifesting, yet you're resisting. Please know that your resistance is only exacerbating your suffering. So take that minute, take that 2 minutes, 5 minutes, 10, and lean into the pain of grieving. And while I don't want to make promises, I am very hopeful that doing so over time with gentle support is going to bless you in many ways.
Yeah, absolutely. Yeah. It's just like, and I think I love hearing that again of just giving yourself that time means that you can just, it's like taking that, like you said, taking that extra pressure off. Because
Hmm.
I think I wonder if we're scared to lean into the discomfort because it's like, I'll be consumed. I'm going to be
Yes,
consumed.
yes. But here's sort of the paradox of that. The fear is if I shine a light on it, I'll be consumed. Yet grief is consuming you, right? Whether emotionally you recognize it, it is. There is a great book by Dr. Bessel van der Kolk, The Body Keeps the Score. So things are happening internally that you can't see, but there are manifestations. So either way, right? But I promise, well, here's the promise that I shouldn't make, but I will. Leaning into it will actually reduce the space and the consumption that you feel, even though you fear that you'll be consumed.
Mm. And I like the idea of how you say like scheduling the grief. So even if it's a 5 minute start,
Hmm. Hmm.
it's the image that comes to my mind. It's like you're taking little sips of it and you're going, okay, 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 I'm in it. And then, oh,
Hmm.
good, my 5 minutes is up. Oh, okay,
Yeah.
I can walk away.
I actually use a timer. To this day, I still use a timer. And so that creates a little container. I know what time it starts, when the buzzer goes off, and it really helps me feel safe. And I know there's an end point. So I know even though I sometimes fear or have fear that there's going to be a flood, the reality is when that clock goes off, I know that it's a contained time. And I may have to do some things to reintegrate back into my day to day, but it really is contained. So that may be another strategy that might be helpful.
Yeah, I think that's a super helpful strategy. Absolutely. And makes me think of like, how dogs shake themselves out off. It's like you have your
Yeah,
moment, the container, and then, okay, shake, shake,
yeah,
shake.
that's right. That's exactly
Yeah.
right.
Yeah, this is so helpful. And thank you for continuing the work of normalizing grief. And you can find Dr. McKell has some wonderful classes inside Heart and Bones, sharing some grounding practices,
Hmm.
talking about the nervous system to help further support you with grief. And I know in your website, and you also have free, like you said, free resources, different ways of just, yeah, supporting grief. So please go follow Dr. Mikkel. She's the best, and you do a lot of just, yeah, a lot of free educational content, which is just invaluable. And so thank you for continuing to put that out there and impacting people in all the ways that you do.
Thank you so much. Again, I appreciate sharing space with you as always.
I hope you're feeling inspired to schedule and nurture and take care of your grief. And if you want to get a sense of Dr. Mekel's classes and what she has to offer, you can always access them inside Heart and Bones Online Studio, which you can also access our free Better Sleep program as a member of the studio. So it's here to help you find more ease, more rest, more fabulousness overall in your life. So get the information for that in the show notes. And as always, thank you so, so much for being here.